I'm not impressed. Yeah, sure. And I can count today. That's what I was.
140 right. Sorry, it's as long as you finish your as not long. Is part of the heart. Yeah. If it's in here, whatever. Listen.
I can read it.
That's when you're gonna down. Yeah.
Awesome, that's how you tell us. You really, you said there. I mean, that's exactly, but he's saying, yeah.
Good afternoon, everyone. Welcome to today's class. At the beginning of class, we have two announcements. First of all, Dr. Gravy has reached out to you regarding the pre-exam 3 review session. Dr. Gravy, have we decided about the pre-exam 3 review section with students?
The poll for the PHCY 432 exam 3 pre-review, I think a couple hours ago. If y'all could fill it out so that we could schedule something by midday tomorrow, I think that'd be awesome. Either way, it'll be done via Zoom.
Yeah. Thanks, Dr. Gravy. And second of all, some of you have reached out to me about the practice questions for exam 3. I appreciate this suggestion, but Dr. Gravy and I have very balanced pool of the questions included in exam 3. And second of all, you all can use the practice questions we covered in active learning or in the Dr. Yes, myself parts presentation. We do not have additional practice question given to you. We don't want to add additional burden to you. And thirdly, I also appreciate some of peers reach out to me about exam 3 question creation task. I do notice there is a group that I did not assign a particular lecture to that group. So like I communicated with the student, that particular group, you can choose one of the lectures at your references. And just a friendly reminder, this task is hopefully due tonight, end of the day, and Dr. Gravy and I will finalize exam 3 by Wednesday, before Wednesday. And I think that's it. Any questions, feedback about exam 3? That's the focus before next Monday, right? And like I said, we will finalize a day to have a pre-exam 3 review section hosted for everybody. I think that's it. Okay, now let us get started. Today, we will covering quality improvement called QI. In today's lecture, we will start with the definition of a quality improvement, and I will use the QI, or I call it continuous quality improvement, CQI, throughout the lecture. And then I will talk about, I would say, a two framework, I'm sorry, I will talk about two framework for conceptualize of quality improvement. This includes the PDSA as well as the Lean Six Sigma framework. And thirdly, I will talk about how the quality improvement is measured. And lastly, if we have time, I will briefly talk about the role of pharmacists in the quality improvement initiatives. This is today's learning objectives. Before I talk about today's lecture, I want to remind everybody about our contents last lecture. Last lecture, we have learned about the definition of quality measurements. And we have learned about the Institute of Medicine's definition that includes 6 dimensions to measure a high quality healthcare system. At the same time, we also spend a lot of time talk about the Donadovian's framework for measurement of quality, including the structure, process, and outcome. Today's lecture, we are focusing on the quality improvement initiatives. So firstly, what is a quality improvement? What is the definition for quality improvement? According to Healthcare Resource and Service Administration, quality improvement is defined as a systematic and continuous action that leads to a measurable improvement in healthcare services and health status of a population. The CDC has a more broader definition for the QI. According to CDC, quality improvement is defined as a continuous and ongoing efforts to achieve measurable improvement in the efficiency, effectiveness, outcomes, and other indicator of quality services or processes, which achieve the equity and improve the health of the entire community. Several things that I want to highlight here. First of all, the quality improvement is a systematic and continuous efforts that leads to measurable outcomes. One, it means that when it comes to improve the quality, it really includes a systems perspective, because the quality issue is usually complex. It includes an entire system to be involved to obtain a measurable outcomes. And the second, quality improvement involves a continuous action, continuous efforts. And thirdly, it is also linked to a measurable outcomes. When we talk about quality improvement initiatives, we are really emphasizing that we wanted to have outcome that is measurable. So those are the three key words or the three key components that we need to understand and digest when we talk about quality improvement. We will use the quality improvements same as the, or another terminology we can use is continuous quality improvement. And we can use both of the two terms throughout the lecture, either it's a CQI or QI are synonymous. And like I said, it involves continuous efforts to make sure there is a measurable outcomes to be obtained. The goal of quality improvement obviously is to obtain ideal patient or population outcomes, and also to improve the safety and effectiveness of the care delivered to the patients. In terms of the QI efforts, like we said, it involves a system to play a role in order to obtain improvement in the healthcare outcomes. And there also involves multiple stakeholders in order to see measurable improvement in the outcomes. And like we said, a key component or key part in the CQI process is the measurement. We need to have an outcome that is measurable. And these are the key principles that we should keep in mind when we talk about the QI efforts. One is the, like we already mentioned, one is the continuous, and the other is it takes a system-wide approach to obtain the QI initiatives. And because it takes a system-wide approach, it also involves team-based efforts. Multiple stakeholders will be involved in order to achieve the QI initiatives. And it also usually is linked to measurable outcomes. And the overall objectives of QI is to have improved population of patient health outcomes, at the same time improved efficiency and clinical process, also to avoid costs. As you can see that the goal of QI improvement is both is to, with overall goal to improve the population outcome by improving the efficiency of the clinical process as well as lowering the cost. Now I know the concept is a little dry here. I want to pause a little bit to ask you which of the following is a characteristics of the QI improvement? I know we spent some time talking about the concept and principle of QI. So which of the following is the characteristics of QI improvement process that we just described? Remember that we mentioned there are at least 3 key characteristics of a QI initiative or quality improvement process. And the second question gives you a scenario. A hospital pharmacy team is working on, is trying to obtain quality improvement strategies with a goal to prevent medication errors during the patient transition from hospital to home. And the team is using a quality improvement in these initiatives and identify and explain which quality improvement characteristic they are utilizing. So for the first question, which of the following is the characteristics of quality improvement? Remember, we talk about at least three characteristics, right? One is system, the other is continuous, and there's also team-based efforts, right? Which that's correct. That's C. So A is not correct because it's a system-wide approach. Quality issue is complex. It usually involves a system-wide approach to solve this problem. And B is not correct because, like we said, it's a continuous efforts. Of course, in the second part, we will talk about 2 frameworks to quantify, conceptualize quality improvement. And C is correct. And D, like we said, the goal of quality improvement not only reduce costs, but also improve efficiency with a overall goal to obtain a better patient population outcomes. Are we all good with this one? This is really, yeah, we have emphasized it. So the second case scenario, in this case, the hospital pharmacy team aims to develop some strategies as part of quality improvement with a goal to reduce medication errors during patients' transition from hospital to home. And which of the QI characteristics or the QI methods or the principles they can adopt in order to obtain their goal to prevent medication error? Of course, there are different ways that they can obtain this task, right? The correct answer are C is definitely correct. And we will talk about that during the second part too. C is definitely correct. Data collection on medication discrepancy so that they can analyze the data to see which part they need to improve. What about others? This is multiple choice question. C is correct. A, okay. A, some of your peers said A, continuous monitor of the errors. That's also correct. And we also mentioned team-based efforts, a part of the QI efforts, right? So this also involves collaboration of nursing staff, physicians to identify where the issues of medication error stems from. And the evaluation of patient satisfaction is also included. Okay. Okay, let's move on. And I really have a good articles about the using QI initiatives to address to reduce the medication error problems. And I think I can share that with you all later. Okay, how to conceptualize quality improvement. In the measurement of quality, we talk about two frameworks. One is non-obedience structure process outcome framework. One is IOM's framework, including 6 features or 6 characteristics of ideal quality healthcare quality system. Here in the QI methods, we will introduce to you 2 frameworks. And I found them also very helpful when you wanted to improve, when you wanted to maybe kind of improve your performance in a class or improve your performance in some rotation. This kind of quality improvement models can also apply to your situation. So I will start with one QI model that is called PDSA. It stands for plan, do, study, and act. And I will briefly talk about them in the next slides. And the other one is called Lean Six Sigma. Lean Six Sigma, it composed of 2 parts. One is Lean part, the other is Six Sigma part. Anyone heard about either one of these models? Maybe the Lean Six Sigma, right? Or you also heard about the Plan Do? Oh, oh, you all from other classes? Okay, do you want to? Okay. Which class have you learned about this PDSA? Oh, another professor taught you from the 431 class. Okay, sure. Okay, sure. Okay. Now you have some foundations about the PDSA. It involves 4 stages. The first stage is plan the change. So in the first stage, when you plan the change, you already have identified some problems, some issues, and then you want to make plans to have some change. And the second is do the change. Do here means implement, means execution is the action part. And thirdly, study the results. It means that you use data to identify or examine whether the plans or actions that you included in your practice actually leads to improved performance. That is the third part, study the results. Okay, use the data to see whether the new action included in your actual practice leads to improve the results. And fourthly, act to hold gains. It means that repeat the process and include, if in the third part, study the result, you do observe that there is improvement in the outcomes after adopting this new action. Maybe the new medication dispensing system has really improved the errors in dispensing. Act means repeat this process to hold continuous gaze. So the PDCA includes 4 components, and it's rapidly repeated cycle for the quality improvement. And the measurement is a very important part here. It includes in the study results that you have a measurable outcomes to be involved for you to say that there's a really improvement in this outcome after the newly adopted dispensing, electronic dispensing, medication dispensing system. Any question here, feedback? Okay. In the QI model of PDSA, ask yourself 3 questions. Firstly, what are we trying to accomplish? This is very important in the first part, P, plan the change. You identified issues and you identify the issues, you make plans. And the second part is how will we know the change is an improvement? That means that you really need a measurable outcomes to answer yourself whether after adopting this change, it really needs to an improvement in the outcomes. And thirdly is what changes can we make that will result in an improvement? As mentioned, the PDSA is an iterative process that involves 4 stages in this model to obtain a quality improvement. The next one is Lean Six Sigma. The Lean Six Sigma includes 2 components. One is Lean, the other is Six Sigma. The Lean means that to reduce the waste or to remove the action that did not add value. That is the Lean part. On the other hand, the Six Sigma part means to reduce the variation to have a standardized or to streamline the process to reduce the variation or to reduce the effects. In the Lean Six Sigma, there are 5 steps involved. We can also identify them as, there are 5 steps involved. Start with define what is value adding to the patient. And the second is to mapping the value streams. And thirdly is to remove waste. And fourthly is to allow the patient to pour the values. And fifthly is to pursuing the perfection as an ongoing goal. In the Lean Six Sigma, it involves these phases called DMAIC, define, measure, analyze, improve, and control. And the overall goal of Lean Six Sigma is to reduce the waste, at the same time to streamline the process as to reduce the variation. Now, I want to pause here a little bit to ask you what is the, of course, we have talked about the PDSA cycle, right? The plan, do, study, and act cycle. So what does the S stands for in the PDSA cycle? Study the results. Study the results means that Yes, analyze data to determine if the plan was successfully. That's correct. That's great. That's correct. What about the PDSA? The A means act, right? S means study the result. That's correct. B is correct. And what is the overall goal of Lean Six Sigma? Remember, we mentioned it includes 2 parts, Lean and Six Sigma. B is correct answer. Okay. 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 Question, comments? Okay. Suggestion? Okay. I want to talk a little bit about the tools to measure the quality. There are different tools and techniques for continuous quality improvement. They are tools to summarize the data, and they are tools to describe a process, and they are also tools to identify problem areas, and they are tools to suggest the solutions. The QI group process tools, the idea generation tools, and multiple voting tools. And those are some examples here. Some of the tools you all may be familiar in some decision-making process, right? The brainstorming and nominal group technique. And there are different types of the voting tools. And on your right hand, as you can see, this is a multiple voting tools on your right hand. The participants or the meeting host can list all the items that as the potential areas for the quality improvement. And the multiple voting tools means that each one of participants can provide his or her votes to either one of these items, and this host can obtain a council vote for each one of the items, as you can see here. This is one example of multiple voting tools that researchers can use in the QI group process tools, as the multiple voting tools for the QI group process. And in terms of the QI analytical tools, there are different types of QI analytical tools, but I really want to bring your attention to this fishbone diagram. As you can see here, it really looks like a fishbone, okay? So this fishbone diagram, it maps out structural brainstorming tools, and it maps out the rule causes for different categories. As you can see that in each one of the category, there is you can list out the different causes here. So it really gives you a good visualization of the causes illustrated in different categories that can explain undesirable effects, or that can explain a potential problems, or help you to identify the opportunities for quality improvement. If you don't remember other analytical tools, but at least you have to understand or remember this fishbone diagram. Okay. Now, there is another term which is very important in the QI quality improvement. Many of you may have heard about this. It's called benchmarking, or you can call it benchmark. It means that comparison of your current healthcare system to another healthcare system, which is considered the best practice. Through the benchmark, the stakeholders can identify opportunities for changes by in-depth evaluation of your health or our healthcare system to healthcare system in other practice sites. The benchmark is about comparison, okay? And it's about comparison of our healthcare system to another healthcare system that is of best practice, that is considered the best. So through the benchmark, of course, through the benchmark, it encourages the competition. It allows us to improve as to the standard of that is considered the best. And also, it uncovers opportunities for change in a good way. So let me pause here to ask you, what is the primary purpose of benchmarking quality improvement? That's correct. That's A. But B, C, D. So the goal is to compare your, as we all know, as we just mentioned, is compare the present organization's performance against the best practice in industry. But they are, like we said, we can, through the benchmark, we can identify different opportunities for the change, right? For us to change in a good way. We can identify maybe that we need to reduce the number of staff required in the organization, or maybe we can also use the historical change to compare the historical change in the present organization as against the performance in the other in the industry, in the organization that is considered best practice. Okay. But the goal is to compare our performance against industry's performance. I want to use a scenario to better help us to understand the principles or the definition or the process involved in the benchmarking. So in this scenario, a community pharmacy has notified that their prescription filling time has been slower than expected, or has been slower than another pharmacy. And the patients also express dissatisfaction with long wait times. The pharmacy, you as a pharmacy manager decides to use benchmarking as part of the quality improvement to improve the, to reduce the prescription, to reduce the prescription filling time. So how you as a pharmacy manager use the benchmarking to improve the prescription filling time? So I would suggest you to, let's just pause here for a minute, think about it. Remember, we have learned about there are different tools for the QI process, right? You can use fishbone diagram. You can use brainstorming tools. So how about you pair with your neighbor for a few seconds? We can at least identify maybe one or two strategies that can be considered as the QI improvement, quality improvement initiatives. You can use a fishbone diagram or anyone have anything want to share? Okay. So, as we mentioned, benchmarking is to compare the current well, first of all, benchmarking is to compare the performance in your pharmacy as to a performance in another pharmacy store, right? Second of all, in terms of benchmarking, as is part of the quality improvement initiatives, it involves measurable outcomes that to be focused on. Here, the pharmacy manager used the prescription filling time as a measurable outcomes for this benchmarking task. The manager can learn from their process and practice, and they can also use other benchmark outcomes, such as they can also consider other measurable outcomes, such as the number of prescription filled per hour, or the use of technology or automation or barcoding scanning. And in terms of the benchmarking process, there are usually six steps involved. First is to identify the key matrix or to identify the key measurable outcomes. And the second is to select the benchmarking partners. That is to select the pharmacy of best performance in the area or in the neighborhood area. And thirdly is to use data. And fourthly is to analyze the data. Fifth is implement changes. And sixth is monitor and evaluate. Okay. Now, lastly, I want to talk about the role of pharmacists in the quality improvement initiatives. For the US pharmacists definitely know that there are different areas that can be considered potentially for quality improvement in a pharmacy department or in a pharmacy store. This includes the patient discharge counseling and the medication ordering and supply, safety and timeliness of medication administration, and any of these process that we listed here can be considered some potential areas for quality improvement. You as a pharmacist can also involved in the quality improvement initiative in your professional areas by the joining some national quality association through some membership. And you can also serve on a committee or quality improvement initiative through that national quality association. And I will talk more about this NQF, National Quality Organizations, includes the IOM, Institute of Medicine, and IHI and NQF. And they have different quality initiatives. Specifically for this national quality organization, they have in the American Society's Healthcare Pharmacists, ASHP, they have statement about health system pharmacists' role in the national healthcare quality initiatives. If you are interested, you can take a look at this statement. It elaborates the different roles you as a pharmacist can be involved in this national healthcare quality initiatives. I know last time we talked about the PQA, and we talked about the PQA develop different types of pharmacy quality measures. So here, I want to list out the, not right now, but in the coming slides, I will list out the different pharmacy quality measures of different purposes developed by PQA. The help. Last time we also mentioned about the how can we calculate a measure, a quality measure. In the calculation of quality measure, there is a denominator and numerator. The denominator is all the target population, and the numerator is the subgroup of the patient group that have received the action or that have received the standard of care as required. This is just to iterate what we have discussed about the calculation of quality measures. This is another slide showing you the WHO surgical safety checklist that have included the a list that needs to a list of safety check different items involving the safety checklist before patients can perform a surgical procedures. And this kind of checklist also help to ensure the safety of patients' procedure. And this is just to iterate what we have learned about PQA's measures. The potential use of PQA's measures, as we know, there are different types of pharmacy quality measures involved in develop that PQA, and they have different uses. They can be used by the pharmacist to compare the quality between different pharmacy across different regions. It can also be used by the healthcare payers or the insurers to assess the pharmacy within the plan networks. And it can also be used by the consumers so that they can choose the best pharmacy, and they can also be used by the researchers like me to monitor or evaluate some of the outcomes for the comparative effectiveness research. And those are different resources. You can just there are some different resources related to quality improvement and quality measurement. And I think that's so far for today's lecture. We focus on talking about the quality improvement as a systematic and continuous efforts. And we have introduced to you 2 frameworks through quality measures. And we have also talked about the different three types of national quality associations. And I think that's it. Thank you all. And we will discuss more about what part to be focused on for the exam 3 in the pre-exam 3 review section. And on Wednesday, Dr. Lindsay will give lecture on her part this Wednesday and this Friday. And next Monday, Dr. Yang will give lecture about pharmacoeconomics. Thank you all.